This community means a lot to me. I chose to stay in this community because I feel like I get a chance to help some of the people that I know very well. I grew up in this community. Some of my patients go to my church. Some of the patients that I see, I went to school with. Health equity means to me that regardless of who you are, that you have the opportunity to receive competent health care. What Morehouse stands for is that we are trying to provide competent health care for all.
Our vision is to change the world. We want to be leading the way to truly create a global platform for health.
The school's mission is to create and advance health equity. We believe that we can actually make a difference and that we can actually move the needle on health disparities and help communities get to these more optimal and equitable outcomes.
Morehouse School of Medicine's strategic plan is really the vision through which our clinical, training, and research enterprises go from what we've always understood to be health disparities and moving that towards decreasing the gap between those who are less fortunate and those who have more access to health.
When you grow up seeing people going blind and losing limbs because of uncontrolled diabetes, that's real to me. Those things are very real in this community. There are issues with hypertension, there are issues with diabetes, there are issues with violence, there are issues with substance abuse. These are the things that affect this community, and how do we deal with it? What can we do to change the outcome?
Bridging between healthcare and health is that medical care alone won't get you to those best healthy outcomes.
We are focused on not just health care, but health. And in order to achieve the health equity, that means paying attention to social determinants of health.
We've never really broken down the clinic wall as a barrier between what the clinicians are doing and what the community are doing. So the child with asthma, for example, when they leave that clinic, identifying policies that will make a more asthma-friendly school.
We're looking at zip codes of patients and figuring out what are the resources we need to help to drive better health outcomes.
There are all these other factors that go beyond just delivering good medical care.
As a physician, I'm trying to change behavior. I'm trying to change the way of thinking. I'm trying to help patients to realize that if I do these things, then I can expect to live a long time.
I think Morehouse School of Medicine stands for a beacon of hope for those that perhaps felt that they had none. Equality, health services, optimized care should be a platform that we promote. The imperative is that we as an institution will start to lead innovation in these areas. We'll start to lead change.
Morehouse, that name speaks volumes to our community. When they see that Morehouse name, they trust that name because that name has been in our community for years. Morehouse resonates with our community. That is a name that says greatness.